Aisha.
Hi.
Hi, I'm Cleo. I'm the social worker here. I'm just going to go over a few questions with you as part of our pre-surgical admitting process.
Okay, but I just gave all my information to...
Okay. Yeah, I understand. Thanks so much. This is different information. So we already have all your basics like your address and your health card and emergency contact information. So it won't take very long. I'll give you a pamphlet that our hospital just produced to go over some of the frequently asked questions about what we're going to go over today. And if you have any questions, you can always ask me, and I'm happy to answer whatever comes up. Okay, does that sound okay? So the questions are around language, race, ethnicity, income.
I'm pretty sure that's legal.
Well, it's not illegal, and in fact, it's encouraged, especially when we're going to use that information to promote equity and for quality assurance purposes. And in fact, we can use that information for program planning and development, service planning, and if patients have unique needs, then we want to make sure that we're meeting them. So it's very helpful for us to learn more about our patient population.
Who's going to be able to see my information?
Only the people in your circle of care, otherwise it's kept confidential. And sometimes it might be used for research, and in which case it will all be grouped together with lots of other people's information with no identifying data attached to that.
Oh, okay. I'm sorry to be difficult. I'm feeling really sick and I'm really nervous about this surgery, so...
Yeah, I understand. So we'll get through this as quickly as possible and get you on your way. So I'm going to give you actually a copy of our questions so you can follow along, because that's probably the easiest way to answer them. Some of the questions, there's a lot of choices. So the first question is, what language would you feel most comfortable speaking in with your healthcare provider?
I feel most comfortable speaking English, but if you have to contact my emergency contact, my mom's going to need an interpreter. She speaks Arabic.
Arabic?
Yeah.
Okay, thanks so much. I'll just make a note of that. And were you born in Canada?
No.
Okay. And what year did you arrive?
19. Are you asking me if I'm a citizen?
No, we just collect this information. It helps us, again, to get to know our patient population better. And if there's any services available to you based on what you share, then we can cater to those needs.
Oh, okay. 1990.
1990. Okay,
Yeah.
thanks. Our next question is, which of the following best describes your racial or ethnic group?
I'm sorry,
We asked this question because we do know that certain ethnic groups are vulnerable or more vulnerable to certain diseases, like Aboriginal population is more vulnerable to diabetes. So by collecting that information, we're better able to service their needs. And we also know that health outcomes sometimes do vary between ethnic groups, and we want to understand if that's happening here, and if it is, to try and figure out why.
Okay, I guess Black African.
Okay, thank you. All right, the next question is on disabilities. Do you have any of the following disabilities? No disabilities, chronic illness, developmental disability, a learning disability.
I have a learning disability and hearing loss.
And hearing loss, okay. Thank you. And what is your gender?
Female.
Female, great. And your sexual orientation?
I'm straight.
Straight, great, thanks so much. And what was your total family income before taxes last year?
What do you mean by family income?
That's the total income earned by a group of people living together as a family.
Well, I'd have to ask.
Okay, that's not a problem. And I'm just going to ask a few more questions, and one of them is, what language would you prefer to read your healthcare information in? And the reason we're asking is because when you come in for surgery, often we give you some written information, instructions for care at home. So if someone's going to be providing that care for you, if they need that in another language, it's important.
Yeah, so Arabic.
Arabic?
Yeah.
Okay, thanks. And the last question I have is, often when people come in for surgery, we like to plan for spiritual care. So if you want to indicate your religious or spiritual affiliation.
Yeah, I don't really see how that's relevant right now. I'd prefer not to answer.
Prefer not to answer? Okay. All right. So thanks so much for spending the time to fill this out. It really does help us improve services for everyone.
Okay, it's no problem.
Okay, great. Okay.